right, so inflammation, yeah, common topic today, probably becoming more topical is terms of something that we're focusing on in the medical world, even alternative nutrition, alternative health. Inflammation really is at the root of very many chronic conditions. You pick a condition, it's probably linked back to inflammation. So in terms of, say, cancer, heart disease, stroke, diabetes, of course, our immune system, every one of those things is related to inflammation at some point down the line. Um, this is something that can be addressed again early on in life, as it should be. It's sort of the chronicity, or the longer you let this go, the more problem you're probably going to run into. So it's something that really ought to be focused on early on and really kind of frequently as well. Aging starts immediately, starts as soon as you're born, it progresses throughout life. This is something that you'd want to address as early as you can. It's not something you address later in life when you're already old. It's kind of late at that point, maybe not a foregone conclusion. But diet, lifestyle are going to be the main things that you need to focus on. Many of the things are going to be common sense. So diet, of course, you don't put something bad in you and expect good results. Exercise, of course, we were built to move. So if you're sitting all day, if you sit most of the day, this is going to be problematic as well. Chronic stresses, which we'll also talk about as well, certainly contribute to all of this. But it's a package deal, and the sooner you get on it, the better. Yeah, so some of the things one really ought to focus on, of course, in that setting uh, is going to be avoiding inflammatory foods. And so there's quite a bit of debate in terms of which foods are going to be inflammatory. There's not a one size fits all, but there's general rules that you would want to follow. So certain things are very obvious. Alcohol in excess certainly is going to contribute to that. So for some, abstaining from it entirely works. For some, moderating it to maybe one or no more than two drinks at a time. Tobacco use, of course, is another one of those, and this one is not controversial at all. Sort of speaks for itself at this point too. And then you end up with some of the things that we are recognizing more commonly now as problematic. So the vegetable seed oils fall right into that category. The more we're learning about them, the more problematic those are seeming as life goes on. So things like that should be left out of one's diet and one's lifestyle. And again, going back to exercise, exercise is anti-inflammatory. So sedentary lifestyle certainly not going to help in that regard. So staying very active throughout life and throughout the day, every day is very important for this. Okay, so unless one has a true vitamin deficiency, let's just say, you're most likely not going to need to spend money on some additional supplement. Certainly there are exceptions to that. But like Hippocrates said, let food be your medicine. Most of what you can get, you should be able to get in your diet. So a well-balanced diet is already going to address some of those deficiencies. They might just be searching for an over-the-counter supplement and spending, quite a bit of money on. Especially if you're doing more than one supplement. I've seen people spend hundreds of dollars per month on things that they really probably could have just gotten their food. Um, the list is almost endless as far as what you probably don't need to spend your money on. So one thing, it might not be a bad idea to test for certain vitamins and minerals just to see if you're deficient in the first place. Um, if, let's just say, you have some problem eating a well-balanced diet, well, multivitamin would probably be sufficient. But beyond that, I wouldn't go looking too hard at uh, various vitamins, various herbs, various spices from the four corners of the world to meet those needs. So one of the potential reasons for that could be uh, where your health already lies. So say you're already in a decent state of health, you probably have the reserve to overcome some of those things. So say some of those stressors, the overnight flights, let's just say, staying up late at a music festival, those kind of things. So in one way, it's kind of a sign of where your body is at in terms of recovery from inflammation or chronic stresses. And so there's various things that one could do, of course, to prepare themselves for those things ahead of time. There's also things you can do to mitigate them as well, or even rebound from them a bit more quickly. But I would take it more as a sign of where your state of health, inflammation, and stress really is before that. All right, so this is going to sound mostly like common sense, but sometimes it's a good thing to hear these again so you can almost make a checklist of them and make sure you're attaining these things on a regular basis. Um, it starts again with exercise. So you need to be physically active throughout the day, every day. Even just simply going to the gym while sitting the whole rest of the day generally isn't sufficient. So frequent movement. The diet, the general principles from earlier that I mentioned, minimizing, if not avoiding alcohol, avoiding tobacco, uh, eating a diet devoid of processed foods, and generally a lower carbohydrate diet at that. And then the other two, one that gets overlooked quite frequently, sleep. This one might be more important, even say the diet and even the activity level. You can negate all of the benefits of your great diet and your wonderful exercise routine if you're just simply not eating enough. The last one would be stress. Certain stressors are unavoidable. Some we may put on ourselves and we really ought not to, and we might know that, but sometimes it's good to take stock of that. But this would be your daily checklist of things to really prioritize. So my name is Anthony Alfano. I'm a doctor of osteopathic medicine. I work primarily for the Lord. He is my main boss, but I am grateful for my employer here at Northside. I work for Northside Primary Care Associates here in Ackworth, Georgia.